Hi, it's Matthew Dickson of mindaid.ca, and I'm going to ask you a favor. One of the things I'm trying to do is get people more aware of mental illness in developing countries. And I know that a lot of people don't have money to donate to some of the nonprofits that I steer people towards who are working in the field. And but one thing that you can do if you'd like to, is start a conversation with people about it. And it doesn't have to be a long conversation. The way I usually do it when I'm talking to random people is I mean mental health is such an easy topic to throw into a conversation these days. And in the last 10 years, it's 2020 now. In the last 10 years, it's become more and more acceptable to talk about. And with the virus in 2020, it's even more acceptable. So I don't find it that hard to work into a conversation. I mentioned if mental health is something that's difficult for you to talk to in a conversation, I throw the words depression or anxiety and see how those go with a person. And anyway, once I'm onto the topic of mental health, I try to throw in mental illness in developing countries, and I don't spend too much time. I don't have to spend too much time on it. There's three things that I usually say. One is one of the first things I throw out is the phrase, "Some countries have one psychiatrist per million people," and I that usually raises some eyebrows. Most of the people I talk to, 2/3 or 3/4 of them, haven't heard about that, and a lot of mental health professionals I talk to haven't heard about that either, believe it or not. And something else I throw out is that some people with mental illness in some countries are actually kept in chains, and those are two of the big ones. I also throw out a stat of over 270 million people in developing countries have no mental health care. And if you go to my website, mindaid.ca, you'll see those three phrases near the top. And so yeah, that's usually about all I have to say. I mean, I can go into it in more depth with people, but often just those three words get people thinking. I kind of feel like I'm Johnny Appleseed throwing out some just seeds of just putting little seeds in people's heads of, oh, I didn't know about that. And often in a conversation, it just might be like 30 seconds, and that's enough to get people thinking along that track. And yeah, that's so if any of you wanted to do that, because I believe if everybody simply knew about this, that millions of people would want to help in some way, whether it's uh, just starting a conversation or to donating to starting their own charity and anywhere in between. But I think that if more people just started talking about this, that they could get more help. And because they desperately need more help and more attention. And with mental illness being such a hot topic these days, I'm thinking, is it okay now? Is it okay to bring up the subject of mental illness in developing countries? Maybe 20 years ago it wasn't the right time for that, or the world wouldn't have been ready. But I think I don't know. Are we ready now? Are we ready now?